family. Well, Local 24 News is working hard to be a source that you can trust for facts, not fear, to calmly help you navigate a time where the information is constantly changing. But don't worry, we have you covered. Joining us to answer your questions that you submitted on Facebook and other social media platforms is Dr. David Connor. He works at Baptist and he studied at Yale. He's been back here in Memphis for 10 years. Thank you so much for joining us here on a Sunday evening. I want to go ahead and get right to it. Several questions coming in. The first one from a social media viewer, as you can see right behind me, is how does this virus spread?
Okay, yeah, so the virus was initially found to spread between animal contact, but now the virus is now being spread community-wide, so now we're spreading it from person to person.
Okay, let's move on to our next question because this is one that people really want to know about. Is it safe to take the kids to the playground? Can I go to the gym? Can I go to the parks?
Absolutely. So I think what we should do now is what we really should have already been doing. Anytime I'm at the gym, there are hand sanitizer wipes that we can wipe down gym surfaces, exercise equipment surfaces. If we're going to the movies or in those places, I would say if you do go, definitely make sure that you're wiping down those surfaces before and after you work out or play with the kids or whatever. So you protect yourself, your children, but those that are coming after you.
Okay, now here's another one. Someone wanted to know what type of antibiotic can I take, but let's be real, there's not a vaccine yet, even though we know that one dose is going to be tested on someone tomorrow.
Absolutely. So in actuality, antibiotics do not treat viruses. So an antibiotic in this case, because COVID-19 is a virus, it would not respond or be deleted by an antibiotic. So what we're doing at this point is just giving supportive treatment to make sure that we make sure that you're getting the supportive care that you need, because an antibiotic will not treat COVID-19.
Okay, we have several more questions, so
Sure.
What I'm going to do is I'm going to ask you to hang around for just a moment.
Absolutely.
And we, like I mentioned to you at home, we have several more questions from viewers. If you still have one, you can go to our Facebook page and weigh in. But as we go to break, we want to remind you of some simple things that you can do to protect yourself. Of course, wash your hands again, and do so for at least 20 seconds at a time. And listen, try very hard not to touch your face. That's because the virus is airborne, and you can get it through your mouth, your nose, and even your eyes. And please cover your mouth when you cough and sneeze into your elbow. Also, you've been hearing a lot about social distancing. Well, basically, that's your personal space. So no hugging, no handshaking. This really gives us time to spend with ourselves and our families if we think about it. Think of it as self-care, which most of us neglect because we are always so busy. It's a time to wind down and slow down. And as our anxiety increases, guess who you can trust? Local 24 News, to search for the facts, not fear, surrounding coronavirus, and for us to be a dependable voice of reason. We're back on the other side of the break with Dr. Connor, who is also a pastor, and he'll tell you how to calm your fears. That's next.